Hi everyone, welcome back. I know it's been a minute since my last video. Let's just say life has been lifing, but I'm glad to be back. So today we're going to be talking about a topic that is very sensitive and very emotional and is not often discussed. So the topic is miscarriages in the first trimester. So if you're watching this, chances are you've experienced a miscarriage or you know somebody who has, or you just want to have a general knowledge about it. So let's get right into it. What is miscarriage? What is first trimester? And why exactly does it happen? So miscarriage is also called abortion medically. I know for a lot of us, when we hear the word abortion, we think, oh, pregnancy that was deliberately removed by the person. But medically, any loss of pregnancy before the age of 28 weeks, that's the age of viability in Nigeria, is called an abortion. So abortion can be spontaneous, it can be induced. When we talk about induced abortion, we have the legal and we have the illegal type of induced abortion. So the illegal one is the one that we know that we call abortion, but abortion can also be induced legally. Maybe the pregnancy poses a risk to the woman's life, or there are other circumstances around it that a doctor would advise that the baby be aborted. So that is induced abortion. But today we're going to be focusing on spontaneous abortion, also called miscarriage in the society. So we're going to be using the term miscarriage today so that we don't get confused or mixed up. So any pregnancy that you lose before the age of 28 weeks is called a miscarriage. So if you've experienced a loss of pregnancy within the first 12 weeks, that's first trimester. So first trimester is within week 1 to week 12 of pregnancy. So if you've lost a pregnancy within this time frame, that's a miscarriage in the first trimester. So now let's get into different factors that would cause miscarriages in the first trimester. The first one we'll be talking about and we're looking into today is chromosomal abnormalities, number 1. Now, chromosomal abnormalities account for 50 to 60% of most miscarriages in the first trimester. Now, what exactly are chromosomes? Chromosomes are structures that contain DNA, and DNA carries our genes. So if you've not heard about chromosomes before, I'm sure you've heard about DNA, you've heard about genes. So let's just look at it as, one structure. Look at it as a set of instructions that tells the baby how to grow. It carries the instructions for the baby's color of hair, color of eyes, and stuff like that. Now, when a sperm cell and an egg cell come together, they each bring a set of chromosomes. So the egg cell is bringing its own chromosomes, the sperm is bringing its own chromosomes. They're coming together to form a baby. Now, in this process of the chromosomes meeting together, there might be a mistake in the way they come together. Sometimes the chromosomes can duplicate or replicate themselves. Sometimes the chromosome might go missing. And when the body sees this, it sees it as something that is not right and, deliberately gets rid of that pregnancy, which results in a spontaneous miscarriage. So now, before we go any further, I want you to know that this is not something that is your fault. It doesn't mean that there's something wrong with you or your partner. This is something that just happens by chance. Now, how is this confirmed? There's a test called a karyotype test. It's not commonly done in Nigeria because, 1, it's expensive. Number 2, it's just not readily available. So if you've experienced one miscarriage in the past before, and you go to your doctor is not just going to jump right into this test. The doctor might tell you, go back, rest, let your body heal and try again. And most times, people who go back and try again have normal and healthy pregnancies. But if you're someone who've experienced like recurrent miscarriages, let's say 2, 3, 4, your doctor might want to include this karyotype testing amongst the investigations to find out what exactly is causing you to lose your pregnancies within this time frame. So, like I said, this is just here to encourage you that if you've experienced a miscarriage in the past before, it's not your fault. It's not something that could have been helped. A lot of people ask, why exactly does this happen? The truth is, we don't know. There's no clear reasons why chromosomal abnormalities happen. They just happen by chance, and sometimes it's just a one-time thing. Sometimes it doesn't occur again. But it's always good to, go and find out why exactly you're experiencing miscarriages around the first trimester. Now, the second factor we'll be looking at is low progesterone. And if you've watched my previous videos, I must have mentioned progesterone about once or twice. Or if you're a woman, I'm sure at some point in your life you've been asked to do a progesterone test. Now, progesterone is a very important hormone in a woman's body, and it's also very, very important for pregnancy. Now, what's its function in pregnancy? Number one, it helps thickens the lining of the uterus to allow implantation to happen during pregnancy. Another function of the progesterone is that it helps sustains pregnancy in that first trimester before the placenta takes over. Now, if you don't have sufficient progesterone level, your pregnancy might not be sustainable in the first trimester. Now, how and why exactly does this happen? Progesterone is a hormone that is produced immediately after ovulation. So let's say your body didn't produce enough after ovulation due to some certain hormonal imbalances, like people struggling with PCOS, people who have thyroid problems. Even increased prolactin levels can disrupt progesterone level in the body. So if you present to your doctor with a history of 2 to 3 miscarriages in the past, your doctor might want to, include this test for you. Now, this test is done on day 21. That's if you have a 28-day cycle. But if you don't have a 28-day cycle, it is done 7 days after your ovulation. So whatever day you're ovulating, just count 7 days. That's the best time to do a progesterone level test to get accurate results. Now, if your test comes back and your doctor finds out or interprets it as you have low progesterone level, you'll be placed on a supplement. Supplements can be oral, it can be through your vagina, that's vaginal pessaries, or it can be given through injection. So if your doctor places you on a progesterone supplement, just know that your progesterone levels are low and you need to optimize it to be able to sustain pregnancy, especially in the first trimester where progesterone is very, very important. Now, another factor that a lot of people overlook, but it's really important and can affect pregnancy, especially in the first trimester, like I said, within the first 12 weeks of pregnancy, is infections. Now, what kind of infections are we talking about? We're talking about vaginal infections, like untreated syphilis. We're talking about infections like severe malaria. We're talking about viral infections like German measles, that's rubella. So if you've had a miscarriage in the past before, your doctor would want to make sure that you're not currently having any infection, and whatever infections you have are being treated before you try again, because as small as this sounds, they affect pregnancy and the way the baby grows in the first trimester. So another factor that affects pregnancy in the first trimester is fibroids. In my last video, we spoke about fibroids, and a lot of people ask questions like, do fibroids affect pregnancy and how do they affect pregnancy? And I answered those questions. So if you want to know more about fibroids, you can just check back to my last video. Now, there are certain fibroids that will grow in certain locations that will affect pregnancy in the first trimester. Now, if you have a fibroid in your uterine cavity that's inside the womb, your doctor might have some concerns. Like, those fibroids are called submucosal fibroids. No matter how small they are, they can affect implantation, or they can limit the space in which a baby is supposed to grow, especially in those first few weeks of pregnancy. So if your doctor finds out that you have a submucosal fibroid, your doctor would want to treat it first through a procedure called hysteroscopic myomectomy. Now, I know it sounds like a very complicated procedure, but it's not. It's actually very minimal invasive. It's a very easy procedure. Sometimes people, you can go back home that very same day, but you still need to see your doctor to know, which procedure or which treatment plan is best suited for the findings that the doctor finds in your body. So submucosal fibroids affects pregnancy, especially in the first trimester. It prevents implantation and it might just lead to spontaneous miscarriage. Now, another factor we want to look at is people who have certain medical conditions that are not controlled, like people with uncontrolled diabetes, people with obesity, and people who have untreated thyroid disorders. We've been managing these conditions for a while, and they're not properly managed. These conditions, like uncontrolled diabetes, can affect pregnancy in the first trimester. So if you're a diabetic patient, you're obese, you might want to work together with your doctor, see how you can get these conditions under control before you try again for your next pregnancy, so that you can have a successful one. Now, another factor we'll look into, it's not very common, but it's called autoimmune disorders. Now, this is a condition that is not always diagnosed. Sometimes it's even hard to come to a diagnosis, but if you present with certain symptoms alongside recurrent miscarriages, your doctor might want to, do some tests to find out if you have an autoimmune disorder like lupus. People who are struggling with lupus might be able to relate to this. So if you're currently managing lupus, you might have had like a history of recurrent miscarriages. But now, like I said, let's not jump into conclusions. Just because you've had 2 to 3 miscarriages does not mean that you have lupus, does not mean that you have an autoimmune disorder. There are other symptoms that you have to present with before your doctor would think that you have an autoimmune disorder. People with autoimmune disorders tend to have like joint problems as well, skin problems. Some of them are suffering with weight loss and many other things. So if you present to your doctor and your doctor sees that your symptoms might align with an autoimmune problem, your doctor might want to investigate through ANA tests, antiphospholipid test, and all of those tests to come to a diagnosis of an autoimmune disorder. So you might want to check that out as well. And then the very last one is lifestyle generally. So some people would say, oh, there are many people who are living like carelessly and still have healthy pregnancies. I want us to understand that our bodies are not the same. Everyone has like a different dynamic as to how their body works. So people who smoke heavily, you drink. Now there are people who drink and still have healthy pregnancy, but if you've had miscarriage in the past, or a recurrent miscarriage, more than 1, more than 2, you might want to adjust certain lifestyles to fit into a healthy space where you can carry your pregnancies till term. Now, these are the factors that mostly affect pregnancy in the first trimester. So if you have any more questions, or you have any more opinions, any more concerns, you can just leave them down in the comment section and I'll get back to you. Thank you very much.